Hello, this is Dr. Kave here to share one of the most utterly ridiculous and negligent stories, complete lack of ethics, involving Matthew Perry. And there is so much to dissect in what has come out of the most recent autopsy report from the coroners in LA County, as well as what the Department of Justice has pulled up in terms of text messages that include what you may have already heard, this famous text between two of the doctors charged in this case, referring to Matthew Perry as a moron. If this breaks your heart, I'm with you because as a physician who uses ketamine extensively in patients, this demonstrates the poison is the dose principle and how an utter lack of ethics can infiltrate the medical system and affect individuals like Matthew Perry, who are suffering from so much physical and emotional pain. To take advantage of someone like that, we're going to go into the story of exactly who the players are and these texts that show what ultimately led to the autopsy report, what's in the autopsy report, and what these 18 counts are referring to. Now, the 5 defendants, we'll talk about 3 of the big ones here, used and diverted ketamine with Matthew Perry. And I'm going to share with you exactly what ketamine does, how I use it with my patients, specifically starting with this individual, Salvador Plasencia, the Dr. P of Santa Monica, and the ketamine queen of North Hollywood. We'll get more into her and what was found in her house. And this individual, Matthew Perry's assistant, Kenneth Iwamasa, 59, who, by the way, has no medical training. So these are the types of texts that have come up that demonstrate just how much malfeasance and utter disregard of ethics was involved in trying to exploit Matthew Perry in the last couple of months of his life, and most potently in the last couple of weeks. I'll give you your first dose if you'd like and leave supplies with you. This is one of the texts found Dr. Plasencia going to Matthew Perry. So what happens when someone gets injected with ketamine? What is ketamine? And why do I use it in so many patients for transformational results? But like I said, the poison is in the dose. The acute effects of ketamine, as well as drowning, coronary arteries, and buprenorphine were listed in the coroner's report for the cause of death of Matthew Perry. Ketamine is one of the most important medications that is used across the world in anesthesia, in the emergency room, and for the last 20, 30 years for mental health purposes. I use IV ketamine specifically in the operating room for patients for pain, for anesthesia, and in my ketamine infusion center for various mental health conditions. Because when used properly, IV ketamine can have a profound and rapid antidepressant effect and anti-suicidal effect, and can be used, at least in many studies, for anxiety, for PTSD, and for other conditions. However, at certain doses, IV ketamine can be incredibly dangerous. I want to take a quick shout out. I want to give a couple of shout out to individuals here who are acknowledging just how much hurt has gone into this case. Daryl Hicks, I appreciate your perspective here. And Pamela Ryan, my doctor would never let me try it and leave me to do it. So these are the misconceptions that surround ketamine that can lead to this type of illicit use that is going to be completely, hopefully, fleshed out for you in a couple minutes based on how prescription ketamine was diverted in the case of Matthew Perry by these physicians, Dr. Plasencia in particular, and given to his assistant for injection. As I was saying, though, when ketamine is injected, it can have many important properties. In fact, if you may remember from a couple of years ago, there was a story of soccer players in Thailand who were stuck in a cave, and divers went into the cave, injected the kids with ketamine, and brought them back out. If you remember that comment, let me know below, because if you remember that story, because it demonstrates that ketamine, when injected, can provide a sense of sedation while allowing you to continue breathing. Unlike opioids, which if you inject them have a very high risk of causing you to overdose quickly and stop breathing. Ketamine at relatively low doses when used for mental health and the emotional pain that Matthew Perry was going through tends to not cause that. However, when you have someone who is just given supplies by a doctor who's not a doctor themselves, not trained in how to use ketamine, is being diverted prescribed ketamine, and then describes in texts to the doctor, I found the sweet spot, but trying different places, and I'm running out of ketamine. This is no longer using ketamine in a safe way, the way that medical professionals do. At high enough doses, it can lead to respiratory depression, compounded by the fact, like the coroner pointed out, Matthew Perry was given buprenorphine, which is an opioid, which can also have depressive effects. You combine these two together, and they can synergize to cause excessive respiratory depression. And if you keep injecting someone with more and more ketamine, which appears to be what Matthew Perry's non-medical assistant was doing, in fact, believe it or not, he was texting Dr. Placencia saying, with code, more cans of Dr. Pepper. I can come down here to make it convenient. These are in text what has been found. This is the degree of utter disregard of Matthew Perry's life and well-being that was circling the drain and spiraling out of control. Because when used at these levels for this much time, ketamine can absolutely have a dependency effect, just like benzodiazepines, just like opioids. By the way, ketamine has been found naturally in the world by a group of scientists in Brazil a couple of years ago. Just like how opioids are found naturally in the world. Just because something is natural does not mean it's safe. And it can absolutely have an addictive potential, especially when used out of context. Like we said, the poison is in the dose. The problem is that this culminated in apparently the last words that Matthew Perry ever said was to Iwamasa asking to be shot up with a big one. These were his last words. A non-medical person receiving ketamine from a doctor who was diverting it and not having the right knowledge in how to use this, the right dose, and how to rescue someone who does get overdosed, who is also on an opioid, who is also in a jacuzzi, and also, as the coroner report said, had coronary artery disease. So here's what you need to know about what happens in someone who gets ketamine and their heart. Unlike most anesthetics, which lower your heart rate and lower your blood pressure, ketamine actually supports them a little bit and can raise your heart rate and raise your blood pressure. So those children in Thailand who were given the ketamine shot so they could tolerate being scuba dived out of a cave were given ketamine at the right dose to keep them breathing, to keep them calm and relaxed, and to keep their heart rate and blood pressure stable. Now, fast forward to Matthew Perry's case, where someone who has an impaired heart, the coronary artery disease means that Matthew Perry's heart cannot tolerate high heart rates or high blood pressure. So if someone goes on a treadmill for one of these treadmill tests, they're at risk of having chest pain if the oxygen demand outpaces what can be delivered to the heart, because the heart needs oxygen to pump. But if it needs to raise a heart rate so high to keep up with running on the treadmill, it can cause chest pain, and then it can cause a heart attack eventually if the heart cannot get enough oxygen. The problem is that if Matthew Perry is getting ketamine at such a high dose that it causes his oxygenation to decrease because he's not breathing, because he's also got an opioid in the system, and he's got an assistant with no medical training who's just injecting him willy-nilly from the Dr. Pepper that he's getting from this doctor illegally, you can become hypoxic, meaning you don't get enough oxygen to your organs, including your heart. And if your heart cannot tolerate low oxygen levels because you have coronary artery disease, that can lead to a heart attack. And then if you have a heart attack in a jacuzzi, I don't need to tell you, you don't need to be a doctor to know that that's not a good place to pass out. Because once you go underwater, you can't get more oxygen. Your heart will be starved of oxygen even faster. And you can't breathe to get any other organs oxygen, like your brain. And by the time Iwamasa had pulled Matthew Perry out, it's unclear if he was unconscious from such a high dose of ketamine and just in a whole different state of consciousness, or whether he was actually dead. I am not involved with this case. I want to be very clear. This is from public domain information that I'm gathering and piecing together the story. But when someone is trying to find the sweet spot in the dose without medical training, this is what can happen. This is why, just like in the case with Michael Jackson and propofol, I use propofol every day in the operating room. It is one of the safest medications when used by the trained doctor. But when used by someone who doesn't know what they're doing, this stuff is dangerous, especially if someone is in an addiction cycle and asking to be shot up with a big one. So what is this ketamine queen? Let's find her picture. This individual here also has an MBA, by the way, was also involved with supplying numerous doses of ketamine to Matthew Perry. Well, the problem is that she was indicted and charged for not only possession and distribution of ketamine, but also having other drugs, like these methamphetamines that were found in her apartment. I don't know what to say at this point other than having doctors and dealers providing ketamine to someone who doesn't even have a doctor using it clearly can be a setup for failure. So I hope that this answers some of your questions. Because this is live, I want to answer so many of the questions. I see many here in the comments. We'll get to everyone. We'll start with Mallard. Good to see you. And we'll start with Katie's question. This is fantastic about hot tubs. I want to say before we launch into the Q&A, if you learn something new, share what you learned with others. Remember that ketamine can be a powerfully effective medication for rapid improvements in the mental health of so many patients. But it has to be used properly. And just because some individuals and some doctors and some street dealers abuse this medication, just like opioids are abused, does not mean the medication is wrong. So many of my patients struggle, and you let me know in the comments if this has happened to you. If you have fallen within the opioid pendulum, swinging you into a direction where you can't receive opioids for a chronic pain condition. Of course, opioids have so many risks, but so many patients are stuck in unfortunate situations with doctors whose hands are tied, who cannot prescribe opioid medications. By and large, opioids are not helpful for chronic pain, but there are some individuals that need them. And I know that they're out there because I treat some of them. And the fact that our hands are tied does not help the situation. And I really hope that just because there are some bad actors out here, including doctors who've taken an oath to help others and divert medications and illegally distribute them and lead to these horrific tragedies, that other patients don't suffer the way that our chronic physical pain patients suffer, because the chronic emotional pain that ketamine can greatly alleviate, sometimes at the root cause, should not be withheld from patients because of these bad actors. Katie's talking about congestive or congenital heart issues and not going in hot tubs. Another issue with hot tubs that we didn't talk about is that when you go into a hot tub, your blood vessels dilate. When your blood vessels dilate, that can lower your blood pressure. If your heart rate cannot tolerate a low blood pressure, because with low blood pressure, you can't deliver oxygen to your heart because the pressure is so low, it cannot fill your coronary arteries to feed the blood vessels in your heart that deliver oxygen and nutrients to your heart. So too little blood pressure can be lethal, such as when you go in a hot tub and if you're dehydrated and your blood vessels dilate to lower your blood pressure, and too high a blood pressure, like with acute effects of ketamine, can be lethal. By the way, I don't know if you're aware of this, but the amount of ketamine in Matthew Perry's body at the time of his death was enough to induce general anesthesia, which is significantly higher than what I ever use in an individual when we're using ketamine for emotional pain, for depression, or PTSD, or anxiety. So this demonstrates just how out of control Matthew Perry's tolerance to ketamine had become, and how out of control his assistant had gone in injecting willy-nilly doses of this powerful and dangerous drug at the wrong doses. By the way, if you're learning something new, hitting the like button helps me do this for you more often. And if you want to join our recently started YouTube membership, you can actually sign up and I can see your comments more easily and answer them. And by the way, I see Pam is a new member today. Easy Money, it's a hilarious name. And Marianne Strong. Shout out to all of you guys. Thank you so much for your support. I can actually see your comments more easily so that I can answer them. Max's mom. I'm a I'm in vet med and we use ketamine all the time. Yes, ketamine is a powerful drug in veterinary medicine and human medicine. We never use it alone because it can cause bad dysphoria. Do humans not have the same side effect? What a good question. When we use ketamine at high doses, I typically use midazolam or propofol with it to help counteract that. Otherwise, if the dose of ketamine is too high, patients can have horrible nightmares. They'll wake up from surgery saying, "Oh my gosh, what happened?" It can be very, very unnerving. At low doses, however, some of those pre-dysphoric effects can actually be quite healing and insightful. Heidi, very good to see you. How does ketamine work so well for these different conditions? We don't know because we don't understand how your consciousness works. If we understood your consciousness, maybe we could understand how ketamine can help access parts of your consciousness or subconsciousness where your emotional pain lies. Remember that all addictions start with pain and end with more pain. If we want to solve that pain problem at its root cause, we need to dig deeper to see where it is ultimately lying and perhaps why it is there. It doesn't have to be psychoanalysis. Some of my patients, however, call it a self audit, a deep meditative introspective experience that can help them identify where the stuckness and rigidity of their pain lies. Very, very good question. Were any of them anesthesiologists? Certainly no one who was there monitoring him or not monitoring him at the time of his death. Good question. Very good question. Only James Brown gets to dance in the hot tub. Gabby, it's sad how people abuse drugs, causing those who actually need them to not have access to them. You're correct. And I know that many individuals have experienced this when they are looking for opioid prescriptions for chronic pain, not in an abusing way, but because they need them, because their pain syndrome is simply not amenable to other medications. Wednesday Snow, thank you so much for joining. I look forward to seeing your questions on here and answering them more easily once I see them pop up. San Francisco hospitals will hire almost any random hippie. Well, I hope you're not calling me a random hippie, but I don't know, safe and effective. I like your username though, safe and effective. If you already are on opioids, can it still help severe PTSD? It's so sad, Matthew Perry. You're absolutely right about great talent, great pain, and exploitative and utterly negligent and malfeasant actions. So I treat some individuals who are on opioids with ketamine, but it's a very slippery slope, and it has to be done in collaboration with a multidisciplinary team. Your pain, guys, the way that I treat patients is that your emotional pain and physical pain are so tightly related, you cannot treat one without at least acknowledging, if not treating the other. So you can't treat your emotional pain without treating your physical pain. You cannot treat your physical pain without addressing or treating the emotional pain. They get processed in similar parts of the brain in similar ways. And the great failure of Western medicine is to not acknowledge this pretty basic fact sometimes, not always, but sometimes. When you're going for surgery, your body is put under a lot of stress. Stress can impact your glucose levels. It can impact the stress level on your heart, and thereby downstream affect your kidneys, your liver, and all of your other organs, including your brain and spinal cord if you don't get enough anesthesia. You have so many videos on that. How was it someone known for being addicted to drugs like cocaine was prescribed drugs, yet people who have pain get punished because of these clowns? Babylon. Injustices in this world. Will the doctor lose his license? They likely will. They'll likely go to jail. You saw these text messages about a moron. This is absolutely heartbreaking. I have an incredibly high pain tolerance from being a former professional athlete. Is that a good or a bad thing? It depends on the situation. Some patients have such high pain tolerances, they don't tell the doctor they're in pain. Some patients have such low pain tolerances that they might be overprescribed medications and it can lead to problems. You have to share with your doctor how you're feeling and be open in your communication is the best I can say. Jody, yes, addiction sucks. Glucose levels go up because cortisol goes up under stress, and that's what your cortisol goes up with surgery. He took this stuff. It's no one's fault but his. You know, Chad, I hear you. It is a tough situation when someone is in addiction and someone is fueling the addiction knowingly because the person has money. I will say that it is a very sticky situation. Hey, my pleasure to be teaching stuff on here, Gail. There are differences between ketamine and medical grade ketamine. Of course, Susan, this is so important because ketamine on the street, especially here in San Francisco where I practice, is far more likely to have fentanyl laced with it, to lead to overdoses. So medical grade ketamine, you know what's in the vial, you know what the concentration is, you can give a certain dose. Very different than things being cut with all sorts of other illicits. And hey, Maria, I'm happy that you are also listening and hopefully learning from this. Symptom chasing is not curing. Wow, this is the problem, among many others, with traditional or conventional Western medicine. We prescribe medications to treat symptoms without addressing the root cause. The way I describe it to my patients, you tell me this, if this resonates with you, let me know in the comments. I'm very curious because most of my patients really find it helpful. If we're a tree, we have all these leaves, these branches. Maybe depression is one manifestation of our pain. Anxiety is another manifestation. PTSD, OCD, maybe diabetes comes out. Many different conditions are sometimes symptoms. If we play whack-a-mole with the symptoms, prescribing a medication for the depression, then a medication to treat the side effects of the medication for depression, then another medication for the anxiety, you can end up falling into what's called polypharmacy. I'm not anti-medication at all. Medications have a powerful role at the right time, at the right place, for the right patient, for the right duration of time. But if we're going to condemn someone to lifelong medication, whether it's an antihypertensive, an anti-diabetic medication, or an antidepressant medication, it should always be with a mind towards, can we be doing something to prevent this from becoming a destination therapy? A destination therapy is a medication that you take for the rest of your life. You'll die taking the medication. It's not meant to be morbid. It's just meant to recognize that this is something that's going to be lifelong versus maybe something like an antibiotic that you take for 2 weeks until you feel better, or 10 days or 9 days, whatever the course is, and you discontinue it. We call those a bridge therapy, a bridge towards your inner healing capacity taking over the rest of the work. When we're using medications in Western medicine, they tend to become destination therapies. That's where side effects, where cost, where other issues can come up, versus trying to find a way to use maybe an antidepressant to not just band-aid the symptom, but maybe try to find a holistic therapy to address the root cause, the root of that tree, instead of playing whack-a-mole with the leaves and branches. Does this resonate with you guys? Have you ever heard of this before? I'm so curious. I'm not a hippie with this. Absolutely not. This is how I treat patients. Robbie G's in the SF Bay area. Represent. I have asked doctors at the hospital, and the treatment it's absolutely not Robbie G. No. Yes, Adventure, they know what I'm talking about for this modality, this mindset for treating patients. I'm so happy that there's others here that know where I'm coming from. Gabby, Victoria Blue, and I agree, it's horrible to lose such an advocate for mental health to this way. And yeah, see the whole truth. I agree, Jody, with what he or she said. So a quick shout out, because of this new YouTube membership plan, if you sign up, it's fantastic. So I can see your comments. You support me to do this for you more often. Nothing changes for y'all who are not part of it, because I'll still get to see as many of your questions as I can, and you'll still get to see all of our live streams. But I do get to see your comments to answer them more easily in the live streams. Hey, Deanna and Joe, I'm happy that you also appreciate the tree and the symptoms, or the source or the root versus the symptom treatment. Hey, I'm wishing the best to your son in med school at Pasadena. In clinical research for years. Very good. I hope that your discoveries can help so many patients out there with root cause treatments instead of symptom chasing, which, by the way, as you know, symptom chasing makes a lot more money. Antibiotics, for example, are not a good ROI for big pharma R&D. It's just the reality. You make a lot more medication if someone takes Ozempic for the rest of their life versus if you had something that keeps the weight off forever with just a finite number of sessions, which, by the way, is why I advocate for ketamine in the right patient at the right time with the right support, because a finite number of ketamine infusions can lead to many, many months of symptom relief, if not a lifetime of symptom relief. It's not about over-exaggerating these results. Nothing is a miracle in medicine. There's no 100% guarantee for any medication. But the safety profile, when used with a professional, is absolutely incredible. And not very many medications can give so much benefit with a finite number of treatments. Sophia, good to see you here as well. I'm happy that it resonates with you, this view of root cause treatments. Street drugs is what we need from time to time. Doctors are not going to risk their license. Well, Chad, that's simply not, that's a tough one. Hey, good to see you in the in the SFA area as well, Neuropilot. Jonathan, starting CRNA school tomorrow. Wishing you luck. My advice for you is to advocate for your patients and do the right thing, because oftentimes you will see very quickly in your training that sometimes the right thing is not always what the system is pushing you to do, not because anyone is good or bad, but because system forces do not put the patient first and foremost. Can you explain once more how to subscribe? Oh, well, that's so easy. There's a join button that YouTube has placed on my channel that you can click to join. The membership I'm referring to is that so you can help support my channel and that I can see your comments pop up more easily, and you get access to some private behind the scenes content that I put up as well. Hey, Tammy, you're so welcome. Paige says, ketamine helped a lot with my treatment-resistant depression, but insurance companies won't pay for it. I have a whole video on why insurance companies won't cover this. And it has to do with patents and patent extensions awarded to S-ketamine, or the intranasal ketamine, that by some clever chemistry was able to gain a patent extension. And that's why it is covered by insurance. Hey, you're so welcome, Marianne. I hope you learned something new to advocate. And if you did, share with your friends and loved ones. I hear what you're saying, alethiometer. I hear what you're saying. I do not want anyone here to think that I'm anti-pharmaceuticals. Pharmaceuticals can have made Western medicine so incredibly powerful for certain cases, in certain patients, in certain settings. But it's not appropriate to condemn people to destination therapies if there are safe alternatives. It's always a risk-benefit discussion. Hey, you're so welcome. And the doctor code, which you should know, is called RBA, risk-benefit alternative. Every doctor has to go through the risk-benefit alternative, whether it's for ketamine, whether it's for an antidepressant, whether it's for insulin, whether it's for an anti-cancer treatment, a chemotherapy. If you don't know about the risk-benefit alternatives, you can't make an informed decision. You cannot advocate for yourself. And the video, if you haven't seen it already, check out the video where I talk about why nice patients come out last. If you don't advocate for yourself, you're less likely to get the best possible care that you deserve. Michael, I'm not a naturopath. I'm a Stanford and Harvard trained MD. I'm an anesthesiologist. I am an integrative medicine physician as well. So I try to advocate for your holistic care because it's going to make a bigger difference for your long-term benefit. Recognizing that Western medicine is probably superior to anything else in the world for short-term emergency care, surgery, emergency room, etc. Guys, I want to end by saying that everyone here has so many positive comments to help empower each other. Heart and Nixie, I appreciate you also sharing with others how to find the join button. But there is so much, I want to say, compassion and recognition of the whole story that's going on here. Lauren Dean's talking about Maya Kowalski's trial. Another case where ketamine was used for such great benefit, but misunderstood by what should have been very high-end doctors at a Johns Hopkins satellite center in Florida. I have a whole video on that as well, by the way. Recognizing that you need to advocate for yourself. Doctors are not meant to be antagonistic. They're not meant to be obstructionists. Neither are nurses, neither are pharmacists. But if you can't advocate for yourself, if you're afraid of being a squeaky wheel, it's going to be difficult for the doctor to know what you need, for the nurse to be able to advocate for you. Watch my video on gaslighting, the main tips to help minimize the risk of being gaslit, so that you can have your symptoms treated, hopefully not just as band-aids, but as the root cause. And I believe you have more power over your health than you've ever been told. And looking through the comments here, I think you all have such a powerful community here, empowering each other, encouraging each other to speak up more for yourself. Because I will say, having been gaslit myself by doctors, it's so hard as a doctor to be intimidated, to be made to feel like you're insane or it's all in your, have you ever felt like it's all in your head? If I, as a doctor, felt that way with another doctor, I can only imagine that a patient whose power differential is so much greater, it's that much easier to be susceptible. So you got to be a squeaky wheel, not in a mean way, but you have to be a squeaky wheel in the sense that you got to not give in to fear or shame or guilt, but give in to trusting your instincts, so that hopefully you don't end up like Matthew Perry. Maybe his assistant trusts his instinct that, hey, this isn't right. My boss is not breathing. I don't think, it's hard to know if he's inherently evil or malfeasant, or if he was being pressured to do something, because some bosses will pressure. In the hospital, doctors are pressured to do stuff all the time. We got to trust our instincts. So do patients. So Melissa, I'm happy that you're advocating. Lola, good night to you. And hey, everyone, such positive feedback here for everyone around here. Remember, you have more power over your health than you've ever been told. Until next time.